For ReachMD, this is Audio Abstracts. The following is produced in collaboration with the Crohn's and Colitis Foundation. I am Dr. Alka Goyal, a pediatric gastroenterologist and a member of the Crohn's and Colitis Rising Educators, Academics, and Clinicians Helping IBD Group, or REACH IBD. Today, I'll be reviewing an article recently published in the Inflammatory Bowel Disease Journal titled Higher Post-Induction Infliximab Serum Trough Levels are Associated with Healing of Fistulizing Perianal Crohn's Disease in Children. The discovery of anti-TNF antibody Infliximab, or IFX, brought about a breakthrough in the treatment of IBD, particularly in fistulizing Crohn's disease. The recommended dose is a 5 mg per kilogram dose at 0, 2, and 6 weeks, followed by maintenance infusions every 8 weeks. The response rate could be affected by several factors, including the patient's age, sex, race, body mass index, surgical history, and disease duration. The use of therapeutic drug monitoring to optimize response is still debatable, and unfortunately there isn't much literature correlating infliximab drug levels with response rate, which is why the authors of this article sought to correlate patients' response to infliximab in perianal fistulizing disease with trough levels prior to the first maintenance dose at week 14. This observational study prospectively followed children with newly diagnosed IBD who were enrolled in an inception cohort involving several academic pediatric IBD centers across Canada. Several variables, including patient demographics, family history, disease phenotype, clinical symptoms at diagnosis, and drug therapy details were collected. For this study, active perianal fistulizing Crohn's disease was defined as having at least one actively draining fistula identified by clinical exam or MRI of the pelvis. The primary outcome was a healed or healing fistula, defined as either closure of the fistula opening or a cessation of fistula drainage by history and physical exam. This outcome was determined at the 24-week clinical assessment following initiation of infliximab. Serum infliximab levels performed before the fourth dose at week 14 were correlated with healing status. The authors found perianal fistulae in 85 of the 406 children with Crohn's disease. 27 of the 52 subjects who received infliximab and had a pre-fourth dose drug level were included for analysis. All patients received a similar standard dose of 5 mg per kilogram rounded up to the nearest 100 mg at week 0, 2, and 6. At week 24, half the subjects responded. The responders were observed to have a significantly higher CRP compared to the non-responders. There was a significant correlation with median serum infliximab level of 12.7 versus 5.5 micrograms per milliliter among responders versus non-responders respectively. The area under the curve was 0.8 and the level of 12.7 micrograms per milliliter was able to predict healing with 60% sensitivity and specificity. Other factors such as patient's age, sex, linear growth impairment, disease activity, hemoglobin, CRP, or albumin did not have an association. The results from this study explain the association of drug levels with disease response in perianal fistulizing Crohn's disease phenotype. Due to the small number of subjects, however, correlation with several important factors like surgical procedures, BMI, and concomitant immunomodulators could not be analyzed, and so this study underscores the need for larger, multicenter prospective studies to examine the utility of prospective therapeutic drug monitoring and other predictors of drug response in children with fistulizing Crohn's disease. If you are interested in this topic or others on Crohn's disease or ulcerative colitis, the Inflammatory Bowel Disease Journal, which is the official journal of the Crohn's and Colitis Foundation and supports the foundation's mission, brings the most impactful and cutting-edge clinical topics and research findings related to inflammatory bowel disease to clinicians and researchers. For more information on the foundation, please visit Crohn'sColitisFoundation.org. This has been a presentation of audio abstracts produced in collaboration with the Crohn's and Colitis Foundation. For more information and for reference links of this article, visit reachmd.com/foundation.